Have you noticed subtle changes in an elderly loved one over the past year? Perhaps they seem a bit off, and you thought, oh, it's just part of getting older. Many of us assume the end of life and old age hits suddenly, like a light switching off. But elderly wisdom teaches us that the body often sends quiet warnings months, sometimes even a full year, before life reaches its final stage. These signs can be so subtle that they're easy to miss or dismiss as normal aging. It's only when looking back that families realize the clues were there all along. But by then, it's often too late to act on this elderly wisdom or apply practical advice for the elderly to make those final moments truly count. Hello, everyone. Welcome to my channel. I'm Dr. Long, a doctor passionate about sharing elderly wisdom and advice for the elderly to help seniors and their families navigate aging with care and compassion. Today, we're diving into a sensitive but crucial topic that draws on elderly wisdom to support those you love in their final chapter. So, grab a comfy seat, maybe a warm drink or a tissue, and let's approach this with open hearts and gentle understanding. In this video, we're sharing 5 key signs rooted in elderly wisdom that often appear in the year before an elderly person passes away. Some might be changes you've noticed, but brushed off as no big deal. Others might seem minor, but are actually the body's way of signaling a gradual decline. This advice for the elderly and their families can empower you to provide better care, cherish meaningful moments, and ensure your loved one's final days are filled with comfort, dignity, and peace. Stick with me until the end, because these signs, backed by elderly wisdom, will help you prepare emotionally and practically for what lies ahead. When you understand these signals, you won't be caught off guard. You'll be ready to make the most of the precious time you have left together. If you're new to the channel, hit that subscribe button and ring the bell to stay updated with more elderly wisdom and advice for the elderly. Here's a little challenge to keep things interactive. If this video resonates with you, drop a 1 in the comments. If it's not quite your vibe, drop a 0. Your feedback helps me craft content that truly supports you and your loved ones. Ready? Let's dive in with kindness and clarity. Number 1, significant weight loss. Let's start with one of the earliest and most telling signs, steeped in elderly wisdom: unintentional weight loss. This might show up subtly at first. A belt that needs an extra notch, clothes that hang looser than they used to, or an appetite that's just not what it once was. Many families wave this off, thinking they're just getting older. But elderly wisdom tells us that losing weight without trying is rarely a good sign. It's like the body's sending a quiet SOS, and this advice for the elderly urges us to listen closely and act with care. This weight loss isn't just about skipping a few meals. As we age, the body can struggle to absorb nutrients efficiently. Muscle mass starts to decrease, a condition called sarcopenia, and vital systems like digestion slow down. When weight loss happens too quickly, it's a red flag that something deeper is at play. The body might not be digesting food properly or processing protein effectively, leading to muscle wasting. This advice for the elderly emphasizes that this loss doesn't just make movement harder. It increases the risk of falls, weakens the immune system, and leave your loved one more vulnerable to infections, which can be serious in their later years. Appetite changes are a big factor here. Elderly wisdom shows that many seniors stop feeling hungry the way they used to. Their sense of taste or smell might fade, making food less appealing, so they skip meals or eat tiny portions. This isn't just pickiness, it's a physiological shift. As the body senses it's slowing down, it stops signaling the brain to crave food as often. The result? Less energy, less strength, and a gradual decline in overall health. Chronic conditions like cancer, heart failure, or kidney disease can also drive weight loss long before other symptoms become obvious. Even emotional factors like depression or cognitive decline can reduce eating, creating a cycle where the body lacks the fuel it needs to keep going strong. So, what can you do with this elderly wisdom? Forcing large meals might cause discomfort and frustration. So this advice for the elderly suggests focusing on small, nutrient-rich, easy-to-eat foods, like smoothies or soft fruits, and prioritizing hydration to keep them comfortable. If you notice your loved one eating less, looking noticeably thinner, or feeling weaker, don't ignore these signs. Consult their doctor to explore underlying causes, but also shift your focus to their quality of life. This isn't about fixing the number on the scale. It's about making every moment meaningful and ensuring they feel loved. If this insight resonates, drop a 1 in the comments to let me know you're with me. And let's move on to the next sign. Number 2, extreme fatigue and weakness. Next up is a sign that's hard to miss and deeply rooted in elderly wisdom: extreme fatigue and weakness. This isn't just feeling a bit tired after a busy day. It's a deep, persistent exhaustion that lingers, even with plenty of rest. Simple tasks like getting out of bed, walking across the room, or even holding a conversation can feel like climbing a mountain. This advice for the elderly highlights that this kind of fatigue is a key signal in the final year of life, and it's something families need to understand with compassion. This fatigue comes from the body conserving its limited energy as organ function begins to slow. The heart doesn't pump as efficiently, circulation weakens, and muscles receive less oxygen than they used to. Elderly wisdom teaches us that this makes seniors feel unsteady, weak, and unable to keep up with activities they once loved, like gardening, cooking, or chatting with friends. It's not about being lazy. It's the body prioritizing what's essential for survival over less critical tasks. Another factor is metabolic slowdown. As the body prepares for its final phase, energy shifts from fueling movement to preserving vital functions. You might notice your loved ones sleeping more, needing longer naps, or struggling to stay awake for long periods. Some even experience sudden energy drops, seemingly fine one moment, then completely drain the next. It's as if their battery is stuck on low, and no amount of rest can fully recharge it. The emotional impact is just as significant. Elderly wisdom shows that seniors who were once fiercely independent may feel frustrated, embarrassed, or even ashamed that they can't do what they used to. They might pull back from conversations, avoid social gatherings, or stop engaging in hobbies. Not because they don't care, but because they're simply too tired. This can lead to isolation, which only accelerates their decline. For families, watching a loved one go from vibrant to exhausted can be heartbreaking. It's tempting to push them to snap out of it or try harder, but this advice for the elderly reminds us that forcing activity won't help and could add stress. Instead, meet them where they are. Let them rest when needed. Offer small moments of connection, like a gentle chat or holding their hand, and make their environment cozy and calm. If you see deep fatigue that rest doesn't relieve, it's a sign their body is transitioning to its final stage. Use this elderly wisdom to cherish quiet moments and show them they're loved, no matter how much or little they can do. If this hits home, drop a 2 in the comments, and let's keep moving forward with care. Number 3, increased cognitive confusion or withdrawal. Now, let's talk about changes in the mind, a poignant sign deeply rooted in elderly wisdom. You might notice a loved one who was once sharp and engaged starting to forget things more often, struggling to follow conversations, or seeming disoriented in places they've known for years. They might repeat stories, forget names, or lose track of time, even if they never had memory issues before. This advice for the elderly emphasizes that these subtle cognitive shifts can begin months or even a year before the end, and they're not just senior moments. This happens because the brain, like any organ, needs a steady supply of oxygen and nutrients to function well. As circulation slows and oxygen to the brain decreases, cognitive function takes a hit. Your loved one might get confused easily, struggle with simple decisions, or even fail to recognize familiar people or places. Some experience moments of clarity followed by sudden confusion, as if their mind is flickering like a weak signal. Elderly wisdom teaches us this is a natural part of the body's decline, not something to fight against with frustration. Emotional withdrawal is another key sign. This advice for the elderly notes that seniors nearing the end may lose interest in socializing, speaking less, or sitting in silence for long periods. It's not that they don't care about you. Their brain no longer processes emotions or engagement the same way. Conversations can feel exhausting, and loud or busy settings might overwhelm them, so they retreat into their own world. You might also notice mood changes. Some become irritable or anxious, while others seem unusually calm or detached from things they once loved. This isn't a personality shift. It's the brain adjusting to the body's slowdown. For families, this stage can feel like losing your loved one before they're gone. It's tempting to try to pull them back into lively chats or activities, but this elderly wisdom suggests meeting them where they are. Speak softly, offer reassurance, and understand that your presence matters, even if they don't always respond. Create a calm, familiar environment to ease their mind. If you notice increased confusion or withdrawal, it's a sign their body and mind are preparing for the final transition. Cherish the quiet moments and let love shine through. Drop a 3 in the comments if you're following along, and let's move on with compassion. Number 4, frequent infections and slow healing. Another clear sign, backed by elderly wisdom, is a weakened immune system. If your loved one, who rarely got sick in the past, now seems to catch every cold, flu, or infection going around, it's time to pay attention. Minor illnesses that used to clear up quickly now linger, and small cuts or bruises heal much slower than before. This advice for the elderly highlights that these changes aren't random. They're signs the body's defenses are fading as it nears its final stage. As the body winds down, the immune system struggles to fight off infections like pneumonia, urinary tract infections, or skin issues. Antibiotics might not work as well, requiring stronger doses or longer recovery times. Chronic wounds, like scratches or sores that don't heal or keep reopening, signal poor circulation. Less blood flow means fewer nutrients and oxygen reach the skin, slowing healing significantly. For seniors who are less mobile, pressure sores become a serious risk, potentially leading to dangerous infections if not managed carefully. What's tricky is that infections in seniors often don't look like they do in younger people. Instead of a high fever, they might simply seem more tired, confused, or uninterested in eating. Elderly wisdom notes that a sudden drop in mental alertness is often the first clue of an infection, even before other symptoms appear. Recognizing these signs early can make a big difference in their comfort and care. Families might feel tempted to push for aggressive treatments, hoping another round of antibiotics or a hospital stay will fix things. But this advice for the elderly suggests that, at this stage, the focus often shifts from curing to comforting. Keeping your loved one hydrated, their skin clean and moisturized, and their environment low stress can do more for their well-being than another round of medication that might only prolong discomfort. If you notice frequent infections or slow healing, it's a sign their body is slowing down. Use this elderly wisdom to prioritize their comfort and peace. Drop a 4 in the comments if this resonates, and let's move to our final sign. Number 5, major changes in breathing or circulation. Finally, elderly wisdom points to changes in breathing or circulation as one of the most telling signs that the body is preparing for its final stage. You might notice your loved one breathing more slowly or shallowly, with pauses between breaths or irregular patterns. Some experience Shane Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. This advice for the elderly notes that these changes can start subtly but become more pronounced over time, signaling a significant shift. Circulation changes are also common and important to recognize. Their hands, feet, or even nose and ears might feel cold to the touch, and their skin may appear pale, bluish, or mottled, especially in the extremities. This happens because the body prioritizes blood flow to vital organs like the heart and brain, reducing circulation to less critical areas. It's a clear sign the heart is no longer pumping as strongly as it once did. Shortness of breath is another clue. Simple actions like sitting up, talking, or shifting positions might leave them winded. They may breathe through their mouth more often or need a pause to catch their breath during a conversation. Fluid buildup in the lungs can cause a persistent cough, gurgling sounds, or a feeling of tightness in the chest, making lying flat uncomfortable. Many prefer sleeping propped up on pillows or in a recliner to breathe easier. These changes can be frightening for families. You might feel the urge to encourage deeper breaths or rush to the emergency room. But this elderly wisdom reminds us that this is often the body's natural way of slowing down. While oxygen therapy or medications can sometimes help, the focus should be on comfort. This advice for the elderly suggests keeping the room cool, using a humidifier, and offering small sips of water to ease discomfort. If you notice changes in breathing, cold extremities, or a bluish tint to the skin, it's a sign the body is conserving energy and circulation is slowing. Be present, offer gentle reassurance, and create a peaceful environment where they feel safe and loved. In these final months or weeks, the greatest gift isn't always medical intervention. It's ensuring they feel comforted and not alone. Drop a 5 in the comments if this insight hits home. Final thoughts. As we wrap up this heartfelt conversation, let's take a moment to reflect on the elderly wisdom we've explored. Significant weight loss, extreme fatigue, cognitive confusion, frequent infections, and changes in breathing or circulation. These 5 signs often appear in the year before an elderly person passes away. They may not all happen at once, and they can be subtle at first, but they're the body's way of signaling its final transition. This advice for the elderly helps you see these signs clearly and respond with love. Watching a loved one change is never easy. Your instinct might be to fight these signs, push them to eat more, move more, or stay engaged. But elderly wisdom teaches us that sometimes the best gift is accepting their limits and focusing on their comfort. Instead of trying to reverse the inevitable, use this advice for the elderly to create moments of peace, share stories, and ensure they feel valued. Understanding these signs isn't about fearing the end. It's about preparing for it with grace. By recognizing these changes early, you can offer better care, make thoughtful decisions, and fill their final months with love and dignity. If this video helped you understand or feel prepared, give it a like, hit subscribe, and share it with someone who might need this elderly wisdom. Your support helps us keep these important conversations going. Think of your loved one's final chapter like a beautiful sunset, fleeting, precious, and deserving of care. Use this advice for the elderly to nurture their peace and presence. What's one small way you'll support your loved one this week? Drop it in the comments, subscribe for more insights, and I'll see you in the next video. Thank you for being here.